Okay, thank you very much. First of all, the last speaker's talk was just fantastic, so thank you so much, and it's not easy to follow that. So my name is Rick Hodes, and I've been a doctor in Ethiopia for 25 years, except I'm an internist, and I became sort of a parasurgeon because all of these surgical cases started coming to me. And I'm following basically one of the models that that the previous speaker was talking about. So let me just introduce you a bit to Ethiopia. We have a GNP per capita of $380 a year, literacy rate of 30%, full immunization rate, this is recent data, of 22%. Most men are circumcised. We have a low HIV rate. There's about 40,000 doctors for about 85 million people. So there's one doctor for every 40,000 people. There's not a lot of surgeons. There's certainly not a lot of surgeons outside of the big cities, and people die because of that. There you see Ethiopia's in the, I don't know how to point, but anyway, Ethiopia's in the northeast. And you can see Somalia on the coast, and we're just to the left. There's the capital city. And Addis Ababa is in the middle, and everything goes in and out of there. Just a few pictures of Ethiopia. You can see that 1/3 of the land, 2/3 of the population lives in the central plateau, so that many of us live at 8,000 feet above sea level, where there's no malaria. Who does the carrying in Ethiopia? The answer is it's not the men. Okay, here in this case, it's the women and it's the donkeys. And this is really a true picture of what goes on. One of the more amazing things in Ethiopia is Lalibela. Lalibela is a dozen churches carved out of solid rock 800 years ago. So if you look at the top right corner, that's about 100 feet from the white figures on top to the white figures below. In order to get down there, you need to go through a tunnel, and then you go into this church shaped like a cross, which is hollowed out, and it's a huge church inside. It's really worth a trip. I encourage all of you to come. And now I'm going to just talk about some of my surgical work and who comes to me. So this gentleman named Yasin came to me, and he really begged me for help. And this is at a Catholic mission where I see patients. And I said, well, take off your the sweater around your face. And so this is actually the good side of Yasin's face. And this is the other side. Okay, so this is a condition called NOMA, N-O-M-A, and it's a necrotizing gingivitis. There's 120,000 cases in the world every year. So this is a really big deal. And there's a lot of people, this is the worst case, I get this all the time, but this is the worst case I've ever seen. And this poor guy is living like this for 5 years. He's lost his eye, and he's lost half of his face, and he's managing to maintain his nutrition this way, but clearly you don't have much of a life when you're walking around like this. And so I got online and I sent this picture around the world to surgeons that I know. You know, I wake up every morning and I thank the Lord that Al Gore invented the internet. And so a Dutch group answered me, and because of this picture, they came and they operated on 15 patients. So this guy, and they now, that's become a whole program. It's now based in London, but they come twice a year, and they stay for 2 weeks at a time, and they just line up these patients. They actually have 1 or 2 people who just scours the country looking for patients with facial deformities. So they did old-fashioned plastic surgery inside Ethiopia. They anastomosed his forearm to his cheek, so he was like this. He had a pedicle flap. And he was like that for several weeks, and then they reattached. And there you can see that neither of us looks terribly great, but we can both function pretty well like this. And so this is actually just, I just threw this in because it's just one of the things which is a major surgical problem inside Ethiopia, and that's one of the causes of facial deformities. This girl came to me last year, and she just had this bulging eye with very good vision. I mean, she really had good vision, and you can see that it's really proptotic. Her EOMs were intact. Now, the interesting thing is, when I'm an internist, so I looked at her very carefully, and she actually has neurofibromatosis on her right side, but not on her left side. So you can see a big cafe au lait spot under her nipple, and you can see that she has freckling of the axilla on the right side, but not the left side. And she's a mosaic in this sense. And I imaged, we have 3 MRI machines in Ethiopia. Each MRI costs $80. You pay $80, you get same-day service. And so I got this MRI, and then I didn't want to rely on our local guys, so I sent this out around the world. And most people say, oh, neurofibromatosis, optic glioma, except that it really didn't fit with that. And there were a lot of unique things about this. She had very good vision, and it really didn't seem like an optic glioma. The really expert people said, be very careful here. We don't know what's going on. So there's another image of that. And you can see that it was read in Ethiopia as neurofibromatosis with optic glioma. Well, we had this visiting team coming in of Israeli eye surgeons. This is a guy who is an Israeli who did a biopsy of this. And he said to me afterwards, he called me, he said, Rick, there's something here that we call a chocolate cyst. And this is pathognomonic for lymphangioma of the eye. I'm sure that's what he had. So he gave me this sample, which I had to treat like gold and get it analyzed. So I send all my pathology to my medical school in Rochester, New York, which does it for free. And indeed, they came out with the same diagnosis. Now, the interesting thing here is that her mother is HIV positive. And I was wondering about the growth factors promoting lymphangioma. Well, it turns out that HHV8, human herpes virus number 8, is a growth factor for this, and I asked them to check, and it was my brilliant idea, but it was wrong. But her eye deteriorated after that. She looked like that for a while, then she looked like that for a while, and clearly this was not going to get better. She did end up losing her vision, and I was able to send her off to Israel, and the team there was able to enucleate the eye and give her a nice prosthesis. She's now back, and she's doing quite well. That's one example. Then people have just been coming to me because I have this reputation that I can cure anything. Unfortunately, it's far, far from true. And people bring me kids with Down syndrome and so on. But then this woman came in, and thank God in some sense for the burqa, because I'm able to evacuate patients in burqas that wouldn't be able to fly otherwise. So this is a girl that I dressed like a burqa because she came to me looking like that. So she has this tumor which had been growing inside her brain for 10 years that we know of. I mean, and it's probably was asymptomatic before that. This is one image, and that's another image. So how can you live like this? It's really, eventually, you can't live like that anymore, and it's going to squash things. Now, I tried to image this, and I did the MRI, did a CAT scan, and I sent this out to neurosurgeons around the world, trying to hope that somebody would be able to help this poor girl, and nobody was interested at all. And then I was in Minneapolis, and I happened to be in synagogue there, and the guy standing next to me and I started talking, and I said, so what do you do here in Minneapolis? And he said, well, I'm a skull-based neurosurgeon. And I said, oh, well, let me show you a case. And so right in synagogue, I opened up my laptop, and I showed him these images, and he said, oh my gosh, I have never seen anything like this. He said, I'd love to help her. So we're able to put her on the plane, send her to St. Paul, Minnesota, where St. Joseph's Hospital comped the hospital care. Dr. Eric Nussbaum and his team did the surgical care for free, and she actually had a very, very nice result. This is another case of somebody who had a burqa. Now, pathologically, that was fibrous dysplasia. We have a lot of these pathologies, a lot of bone tumors, a lot of fibrous dysplasia, a lot of desmoid in Ethiopia. I have no idea why. This is another patient who I dressed as a Muslim, and there you can see us in the Frankfurt airport. That's the head of the Dental Association in Munich, Germany, who raised money for this. The dentists in Germany don't have a good reputation. They have a good reputation for being good dentists, but they make a lot of money, and they're not supposed to be caring. This gentleman wanted to show that they care, so he took on a couple of my patients and raised money for them. This is how she came to me. So this is really one of the largest jaw tumors in the world. Clearly, I have never seen anything like this, and I get some of these things all the time. So that's one view. That's the side view, and you can see that's the reconstruction of the CAT scan in Munich, Germany. So this is an ameloblastoma. That's a non-malignant tumor of the dentin, but there's a lot of these in Ethiopia. I mean, I see 4 or 5 ameloblastomas a year, and it's something that I'd never heard of before I got to Ethiopia. So in order to do this, you need really, really world-class care. And so the team of Dr. Peter Cornelius and Michael Ehrenfeld in Munich raised 35,000 euros to pay their hospital to do this case, and they were able to. You can see that the ramus of the mandible is okay. They extricated the entire thing, and then they made a new jaw. That's the other side. They made a new jaw out of her mandible, of her fibula, to make a mandible, and there she is after surgery. So I've sent several patients to them, and then they came to Ethiopia last year, and they did one major case a day for a week, and now we're planning the next round of things like that. So well, at least we can help some of these people with very, very disfiguring tumors. Now, but the main thing I do all day long is heart disease and spine disease. So I'll show you my data later on, but this is just one example. This is a 16-year-old boy whose heart looks pretty good. You can see that he actually has tight mitral stenosis, but the heart size is okay, and he's out of failure at this moment. But his normal mitral valve area is between 4 and 6 centimeters squared. His is 0.6. You don't live when it gets below that. So he really had, his lifespan was limited to months. And so I send these patients, we bring them actually, to Cochin in southwest India. And the group there at AIMS Amrita Hospital, which is started by a Hindu holy woman, are my partners. And so they admitted her, and this is this is the sign up there. Dr. Krishna Kumar is my counterpart. He's a Harvard-trained pediatric cardiologist who went back to Ethiopia. This is the entire team. The bald guy on the right is my staff. And you can just, a couple of pictures of the hospital. So they did balloon valvuloplasty. It cost me $1,600. And his valve went from 0.6 to 2.1. The data on this is that he will be able to live at least 10 years, maybe even 15 years with that native valve without another procedure. So this is a highly cost-effective thing. I'm getting so many of these cases now that we want to bring in Krishna and his team to do a lot of these, just to do 1 week of valvuloplasties and other procedures, because this is such a common problem due to mitral stenosis. I think the Indian surgeons are often better than the American surgeons because they get these cases more often, and they get these extreme cases more often. I get 2 or 3 Epsteins a year. I get 2 or 3 teenage tetralogies a year, and I can send them off to India, and the Indians will just say, oh, it's another teenage tetralogy, while doctors in the United States are not so used to this. So this is the last group that I sent to India. All of these patients came back after heart surgery. The medical bill for the entire group was $45,000. So I'm not sure if you can get a hysterectomy in Salt Lake City for $45,000, but here I'm getting a dozen heart procedures, some of them surgeries, some of them valve replacements, and some of them procedures, but the entire cost of the surgery, not the airfare, is $45,000. Now, I never thought that I would be spending my life in Africa as a spine doctor, but what happened was in 1999, I met these 2 smiling guys. The guy on the left has a 120-degree angle from tuberculosis of the spine. The guy on the right has a 90-degree angle. So this is Pott's disease. These were abandoned orphans who were living in the room for sick, unadoptable kids at Mother Teresa's mission. And I really wanted to help them, and I digitalized things and sent them out. And nobody was interested. It's very difficult to get free spine surgery. So then I got my brilliant idea that I would adopt them and add them to my health insurance and do that. Aetna loves me. So that's what I did. And I actually adopted them. And here you can see them after their surgeries at Texas Scottish Rite in Dallas. And you can see the younger one and I are balancing here. I actually sent this to Dan Sukato, his surgeon, with the caption, "Spinal stress test successful." The following year, this guy came to me and he needed spine surgery. You can see that he has a malformed T10. He was also born with anal atresia. So he actually has Vater syndrome or Vacteral syndrome. And he would have become paralyzed quite soon. So I ended up adopting him and adding him to my insurance, and here he is after surgery. But serial adoption is probably not the answer to spine disease. So I had to come up with a better solution. And so then I met the guy on the right, whose name is Ohanabo-Boakye Aje. The reason that both of us are laughing is that as we were taking this picture, somebody said, 2 Jews and a Christian. And so Dr. Boakye is, in my opinion, the best spine surgeon in the world. And so now we're doing extreme surgery at extremely cheap rates. So I just want to present one guy. This is a guy who also had his aortic valve replaced, fortunately with a biosynthetic valve in India. But you can see that's his spine. This is a severe, severe scoli. Okay, and here he is. Okay, that's the X-ray. Okay, now the interesting thing is, think about anatomy, T1 and T10. His T10 is higher than T1. Can you imagine how we would feel if our T10s were higher than T1? And you can see his FVC is 39% predicted. So he's lost, and this is actually pretty good. If they're above 30%, I'm pretty happy. But he's lost 61% of his lung function. So we sent him off to Ghana, and in Ghana we have this traction program where we drill 6 holes in the skull, we put in the halo, and there's ambulatory traction, which actually was invented in Texas. So you can have sitting traction when you're sitting in a wheelchair. You can have standing traction. You can see Ephraim, the patient in question, standing there, and then there's lying down traction. So you can be stretched for 23 hours. He then underwent 1 good day of surgery. There he is on the operating table, and here he is afterwards, and he has a pretty good life right now. So the medical bill for this was $20,500. I can tell you that includes the traction. Dr. Boakye did traction on a physician recently in Hospital for Special Surgery in New York. That guy had very good insurance. His medical bill was $1.25 million. This kid's medical bill is $20,500. And so it's a huge, huge difference in savings. And one of the things that we're sort of thinking about for the future is sending Americans who need traction to Ghana to be done there under Dr. Boakye or my own supervision, and then doing the surgery either there or back in the United States. So here's some of my data. When I started the spine program in 2006, I got 20 new spines. By 2012, I got 296 new spines. And now we're well into 2013. I'm probably about 1,100 spines or so. And I've gotten over 200 spine surgeries. At this moment, I have 40 patients in Ghana. And similar thing for the hearts, I get about two spines for every heart. Here you can see a bunch of kids before they go to surgery. There's the other side, and I'll just close right there with a quote from Teddy Roosevelt. There. Thank you very much.